Welcome to the medical lab. Today, we're going to examine the precise procedure for the indirect HCG test. HCG is the primary hormone detected in early pregnancy, and its accurate measurement is critical. The indirect method works on the principle of agglutination inhibition using specific antibodies. To perform this test, we require the patient's sample, HCG antiserum, and HCG-coated latex particles. Begin by ensuring the patient's urine or serum sample is at room temperature and properly labeled. First, mix the sample with the HCG antiserum. If HCG is present, it will bind to these antibodies. Next, add the HCG-coated latex particles to see if any free antibodies remain in the solution. Visible clumping or agglutination indicates that no HCG was present to neutralize the antiserum, a negative result. A smooth mixture with no agglutination confirms that HCG was present in the sample, a positive result. This indirect method provides a reliable way to confirm pregnancy in the laboratory. Thank you for joining us.